Chronic obstructive pulmonary disease, or COPD, is a disease that makes it difficult to breathe. COPD can be best described as chronic, long-term, obstructive, blockage, pulmonary, lungs, and disease, sickness. The most common forms of COPD are emphysema and chronic bronchitis, which is inflammation and infections of the lungs. The most common cause of COPD is smoking. Pollution also causes or triggers COPD. Weather, dust, allergies, and respiratory infections often trigger COPD. Living with lung disease means learning to control it. There are treatment plans that can help you better manage your COPD. If you smoke, find a way to quit. It's the best thing you can do to help control your COPD. Stopping smoking slows the progression of COPD. Most lung infections are from smoking, so talk to your senior whole health nurse care manager for smoking cessation programs in your area. Take all your medications as prescribed, learn proper breathing, reduce stress, drink water, exercise, eat healthy, and always work closely with your healthcare team. On a daily basis, it's important to practice your breathing exercises. To start your daily practice, breathe in slowly through the nose for 3 counts. Purse your lips as if you were going to whistle, and gently and slowly breathe out through the pursed lips for 5 counts, or until all air has escaped naturally. Pursed lip breathing can be done anywhere at any time. Make your breathing exercises a habit. Don't wait until you're short of breath to learn how to breathe more slowly. Stress may cause you to become anxious. When you're anxious, it's harder to breathe. When you feel short of breath, do your best to stay calm and in control. Focus and practice your pursed lip breathing so when you feel overwhelmed, you'll know how to stay calm. Discuss a plan of action for stress reduction with your doctor or healthcare team. Healthy eating is an important factor to overall good health. Eat foods from all food groups and drink lots of water. Eating large meals can leave you feeling full and short of breath, but eating smaller meals throughout the day will make you feel less hungry and able to breathe easier. Just because you have COPD doesn't mean that you should not exercise. Just the opposite. You should develop a daily exercise routine to help expand and strengthen your lungs. Determine the time of day when you're at your best. Start slowly. You'll feel stronger every day. Your doctor should approve all medications, including over-the-counter medicines such as cough syrup. Do you know the difference between your rescue inhaler and maintenance inhaler? Maintenance inhalers are the long-acting inhalers. They will not relieve your breathing instantly. The dose you take will last all day. Rescue inhalers are quick-acting inhalers. They work within minutes to relieve your symptoms. Carry this with you always. Don't leave home without it. You should know how to use all of your inhalers properly. Remember to prime your inhalers for first-time use and always shake inhalers before each use. Always follow your doctor's instructions. If you are taking multiple puffs in a dose, you need to wait a few seconds after the first puff, as this opens up your airways and allows the next puff to go deeper. It's always a good idea to rinse your mouth out after using any of your inhalers to prevent oral infections. If you're having trouble using your inhaler, please talk to your doctor. A nebulizer is a machine that sprays a mist of medicine into your lungs. Keeping your nebulizer clean is vital to good lung health. Remember to take exactly as directed by your doctor. Did you know that oxygen is another type of medication? When you're on oxygen, it's important to know how to handle and use the equipment. If you have questions regarding your oxygen equipment, the supply company will be able to help you. Bacteria can lead to infection, so replace your tubing monthly. Never smoke or use oxygen near a gas stove or open flame. Don't change leader flow without talking to your doctor. And don't use Vaseline-based products, as this can create less airflow. There are ways to stay healthy. Get your flu and pneumonia shots. Be sure to wash your hands and stay away from people who are sick. When you have COPD or any chronic disease, it's important that you listen to your body. Accepting lifestyle changes will make dealing with your chronic disease easier. Many people experience emotions when faced with challenges in their life, and COPD has its challenges. Remember to conserve your energy by taking breaks and working at your own pace. It's important to know warning signs and when to call your doctor. Look for changes in your breathing or cough. When a cold lasts more than 4 to 7 days, change in mucus color, fever above 101, or if you have the feeling as if something is stuck in your chest. Call your doctor or nurse immediately if you experience any of these symptoms, especially if you feel that they are getting worse. Don't wait. This call could save your life. Living with COPD is not easy. With education and good communication, you will learn to control your lung disease rather than letting it control you. Senior Whole Health. Simple, secure, independent.